Hi, I'm Dr. Rahman, and welcome to Black Women's Health. Today I have a question for you. Come closer. Seriously, come closer. This is a very personal question. Are you lonely? The U.S. Surgeon General issued a report May of this year, which said that in this country, the United States, there is an epidemic of social isolation and loneliness. And this preceded the COVID pandemic. This public statement was issued by the Surgeon General to inform people and to make recommendations as to what we can do to ameliorate the situation. The Surgeon General went on to say that in 2014, when he assumed the responsibility of being the U.S. Surgeon General, he did not view loneliness as a public health concern. He goes on to say that over the years and with talking with people from across the country, many people were reporting feeling isolated, feeling invisible, feeling insignificant. And again, this predated the pandemic. The pandemic helped to highlight this issue further. Now, the Surgeon General goes on to make a distinction between social isolation versus loneliness. Social isolation is having too few relationships or social roles or too few group memberships or infrequent interactions. Loneliness is a subjective feeling where even in a group or even within a relationship, you have unmet social needs. The Surgeon General goes on to say that like food, water, and shelter, social isolation is fundamental to our human needs. And the sad part is that there are millions of Americans who lack adequate social connection. In a study done 2022, 39% of Americans reported, only 39% reported feeling that they had a strong connection with another person. 50% of the people have said that they're feeling lonely. And this is more prevalent than the percentage that smoke, the percentage of Americans who are diabetic, even the percentage of Americans who are diagnosed as being obese. However, only 20% of the people who say that they're lonely recognize it as a problem which can affect their health, a problem which can affect the society, or more specifically, the community that you live in. And so this report is to make people aware that, first of all, this is not normal. This is not something that people should just accept. There are changes that can be made. It's a problem for the individual, and it's also a problem for all of us collectively. Social isolation, loneliness is a problem which we can't solve by ourselves. We can't do it alone. What we know is that over the decades, the number of close friendships have declined. Pause for a minute. How many close friends do you have Who can you call at 2 o'clock in the morning if needed? Family size has declined. The marriage rate has declined. The number of people that have memberships in organizations, who go to church or involved in clubs, has declined, while the number of single person households has doubled. And you may ask, well, who's at risk for social isolation and loneliness? Actually, all of us. But there are some who are at higher risk than others, and this includes those with physical or mental illnesses, those that are elderly, and yes, those of certain racial ethnicities. From a health perspective, we should understand that social isolation is more serious than air pollution. It can cause more health issues than obesity, physical activity, more health issues than drinking 6 alcoholic drinks per day, or the equivalent of smoking 15 cigarettes per day. It has been shown to increase the risk for heart disease, stroke, diabetes, dementia. Whereas being within an environment where there is social support shows that it helps to reduce and or help people to manage all of these above illnesses. It helps to protect against depression, self-harm, and suicide. That being said, there is a potential negative aspect to social connection. When we seek out people who are just like us, we tend to form gangs and or extremist groups, or develop a mentality of us versus them. And that's the potential negative underbelly of social connection. And so the question becomes, is there anything that we can do? And the answer is yes. What specifically? We can seek out and engage with others. We can become involved in local community organizations. We can talk to our neighbors, and we can do this on a regular basis. We can share a meal with a person. We can actively work to develop and cultivate, strengthen the relationships that we have, and to seek out new and different people to explore, to learn about their world and their perspectives. And if we are lonely, and if we understand that we are being negatively impacted, we should make it our business to seek help. We can't do it alone. We could never do it alone. Take care.